Hi there, my name is Cassandra Cannon. I go by Cassie. I'm a licensed clinical psychologist as well as an EMDR approved consultant and an APA approved sponsor to provide continuing education. And I wanted to follow up from a recent video where I talked about some of those checklist components that need to be completed before someone's ready to begin processing. And I discussed this information a little bit in that video, but I wanted to go more deeply into how you evaluate if someone really has the capacity to have a positive experience during the reprocessing. And so there's different domains that I like to think about. And the first two I'm going to talk about together because they can overlap a little bit. And the first is emotional regulation. And what that is someone is able to identify their emotions. They even have some coping skills to use to bring some of the intensity of the emotions down. And they feel a bit more comfortable with what do I do with these emotions. Distress tolerance is a little different. It's about, can the client stay with the emotions without destabilizing? So can they stay present when something uncomfortable comes up? Do they shut down? Do they dissociate? Can they recover within that session? So someone might have coping skills, but still not be able to tolerate much distress. And so I'm always assessing both what can they do, emotional regulation, and what can they withstand, which is distress tolerance. And there are specific tools that you can use in preparation to help your clients strengthen and develop each of those domains. The next two domains I also like to talk about together, they also overlap a little bit, is dual attention versus dissociation. And so dual attention is, can you stay here with me while reviewing the past? You might be thinking it also connects a little bit with distress tolerance too. Whereas the difference with distress tolerance and dual attention is, I like to think as distress tolerance is, we're not looking at the past right now, just can you tolerate discomfort in general. With dual attention, it's got another layer, which is, can you tolerate the discomfort and maintain staying here while reviewing the past? And if someone has zero dual attention, then that means they're fully dissociated. But you can be dissociated a little bit and it still be helpful. Let me rephrase that. You can still be dissociated to a certain degree and have reprocessing still be effective. So that's what I mean by dual attention can overlap with dissociation. But if you're able to some degree, stay here while reviewing the past, even if you're a titch dissociated, it can still be impactful with the reprocessing. So with dual attention, are they oriented to the room? Can they track my voice? A lot of times I like to speak over sets to help people maintain that dual attention. And dissociation, it can look more like spacing out. They're distant, disconnected. They've lost track of what's happening. They're not able to respond. So dual attention is, do they have the capacity to stay here while we're going there? And dissociation, if it's to a certain degree, then they're really losing the connection to the present. And so then there's no dual attention. And regarding dissociation, a lot of the training that people get is they'll be told, do the DES2, and then they're not actually told what to do with that information. And I'll be doing a different video on that because I feel like that's a huge gap in EMDR treatment and training. For the purposes of this video, you want to have at least screened your client. I prefer finding out the specific ways they dissociate, and there's different screeners for that. And then Are they able to tell me when they're dissociating? Are they able to tell me the degree to which they're dissociating? The back of head scale is something that Jim Knipe uses. You and your client can come up with your own way of identifying how strongly dissociated they feel. It could be 0 to 10, whatever you and your client feel comfortable with. Your client should at least have a screening dissociation, and if they have some dissociative symptoms, how are you going to address those in session? Then there's the between session stability. So what happens after session is also really important. Can your client tolerate distress between sessions? Do they have coping strategies? Do they use them? Do they have supported loved ones that can help them? So what happens when I'm not there? If they have really chaotic home life or things are unsafe, the processing that you're doing in session can be impacted by that lack of safety in between. So you want to make sure that your client has some safety in between sessions and they've got support and can access that. And then another domain is insight and treatment understanding. What that means is, does your client understand why we're going to the past? There are people who do not want to look at their past. They just want to address their current symptoms. And for those people, there are different types of treatments, CBT, ACT, those are two big ones, DBT, that really focus more on the present moment and teaching coping skills. I personally really like EMDR because it goes to the root as to why you're experiencing this distress. And so rather than having to have coping as your main thing, when you treat the past and the reason someone's having these reactions, then many times they're not even having the reactions anymore. But if they are, they're so much less than they used to be. And then clinical stability, again, like previously, safety concern, any recent crisis or hospitalization, and are they medically stable? Are they at risk for self-harm? Those are things I also want to evaluate. And remember that preparation, you do the initial preparation phase, but you're still monitoring that throughout treatment. So you may be pausing EMDR for a period of time if there's some other things going on that require you to stop that. So if someone's having some medical concerns, you may need to take a break and focus more on supportive therapy. So the main point I want to make is capacity isn't just one thing, it's multiple domains that are working together. And so they might look ready in one area, but not another. And because I like to have things very clear and documented, I created a tool for that. It's called the EMDR Preparation Capacity Assessment and Stabilization Planning. And it goes through each domain, the indicators of if they meet the domain or not. And then the second half actually connects the domain that needs development along with the preparation tools to specifically address that domain that needs development. I hope this information was really helpful for you in helping you prepare your clients, but also feel more confident in treating your clients as well. Thanks for spending time with me.